My name is Mark Golledge. I lead the work at the Local Government Association around information and technology, particularly focusing on the role of adult social care and the interactions with health. Whenever we talk about information technology, we often talk around people, process and technology. And the people dimension, the culture and behaviours dimension is absolutely crucial part of that. So in our work over the last year, working with the centre, that people dimension has been absolutely crucial in terms of building trust, not only across organisations, but also building trust with patients, with citizens and with carers as well. What we're starting to see a lot more is coordination of services around an individual. So when we're talking about health and care integration, for example, we're talking about how can those services better coordinate to support improved care and improved coordination of care for patients and citizens. And the interface and the engagement across organisations is really important in terms of building trust between those organisations. So the work we've been doing with the centre has really been about exploring where there's good practice, where there's evidence in terms of some of the learning from local areas around where trust is not only being demonstrated and built across organisations, but also where trust is being, where there's a strong engagement with patients and citizens and with service users. So over the last year, we've been working really closely with a number of localities that have been focused really around understanding the purpose of why they want to share information. I think there's sometimes a danger that we can perhaps jump into an individual programme, and sometimes a danger that we may not give thought to actually what are we trying to achieve. And where there's successful initiatives, it's really based around some of the things like the Caldecott principles and certain areas such as ensuring that there is clarity around the purpose for which information is seeking to be shared, and also strong engagement with citizens and with the public, particularly where there's a strong collaboration and co-design of those programmes and initiatives with patients and with citizens. So there's certainly, when it comes to health and social care, there is a strong emphasis around integration, a strong emphasis around coordination of care across different organisations, and the importance really within that of building trust across organisations, but importantly building trust and demonstrating that trust with individual members of the public in terms of how that information is shared.